Hey there, this is Dr. Kevin Christie, and today we're going to discuss the cumulative injury cycle. I get a lot of patients that come in with overuse injuries or cumulative injuries, and they don't really know what the cause of this was. There wasn't a single traumatic event or episode that they can relate it to, like picking something up or spraining an ankle or things like that. And so we see this in not only our athletes, but we also see it in our desk workers as well. But for the sake of our athletes, it gets very frustrating for them because it takes them away from their sport and they don't really have a reason why. Like, oh, I've never had this before, or I haven't changed anything. And this is really what is the cause of of overuse injuries, and it's this cycle. And so I'm going to break it down really easy for you so you understand how your overuse injuries are occurring and then how you can prevent some of this from happening, or if you do get to the injury, what we usually do to try to get this cycle to reverse itself. So let's start where it says overwork results in. So if you're a triathlete, a marathon runner, a CrossFitter, a tennis player, a golfer, whatever the sport may be, you're active, typically that is going to have a level of overwork. And what can happen is you're going to develop some weak and tight muscles. Now, we can target the overwork aspect. Like if you're a runner, having proper running shoes or a proper training program, proper nutrition, that's going to decrease the overwork in a sense. Or if you're a golfer, obviously having a really sound golf swing will place less stress on the body. And so there's certain things we can target from an overwork standpoint to reduce that strain on the body. But essentially, when the body gets into an overworked state, you're going to develop certain weaknesses and tightnesses in the muscle. Every muscle in your body either tends to become weak or it tends to become tight. For instance, the abdominals tend to become weak, the glutes tend to become weak, hamstrings tight, calves tight, and so they all fall into that category. And when there's abnormal biomechanics or increased stress, they'll tend to go into that. If you happen to have a sedentary desk type job and you're an athlete, a lot of that sitting will cause some of those muscular imbalances. And one of the biggest misconceptions is that your sport will correct those muscular imbalances. What actually happens is it enhances or really it kind of clarifies that issue. So if you are a golfer and you sit all day, it's not going to, like, golf's not going to help work those golf muscles in a sense. You're actually going to take those imbalances to your golf swing or take those imbalances to your, running or swimming, whatever it may be. So we develop these weaknesses and tightnesses. And what that ends up happening is you get a friction, pressure, or tension in that area. So let me take two, examples of that. One is IT band syndrome or runner's knee, the pain on the outside of the knee from a lot of different types of movement. You're going to get a lot of friction of that IT band across this bony prominence of the knee. And really what that is an imbalance. It's usually weak glutes, tight IT band, tight TFL, tight hip flexors, tight QL. It really is a muscular imbalance that ends up causing that IT band to kind of be taut and then cause friction over that. And then that friction occurs and it leads to a decreased circulation or swelling, which is the next category. And that is a hypoxic state or a lack of oxygen. So make sure you understand that blood flow and oxygen are key to healing anything. That's why if you tear a labrum in the shoulder, it doesn't heal itself because there's no blood supply there. So you need to have oxygen and blood supply with the nutrients to help heal an area. Well, when there's increased friction and pressure and tension on the area, that actually doesn't occur, unfortunately. And then from there, the body actually will cause adhesion or scar tissue in that region. It's almost like a protective mechanism. It's trying to heal, but it's just a process that the body goes through, unfortunately, and that decreases the blood supply even more, and it makes the muscles weaker and tighter. So if you get like an adhesion in your hamstring, that hamstring is going to tend to become tighter, and then it's going to lead to that cascading event. So now the hamstring becomes tighter and the glute becomes weaker, and now you just keep on feeding this cycle over and over and over again. And the crazy part about it is this can lay dormant for a long time. If you're a runner, it could lay dormant for months or years. If you're a desk worker typing, it can be like 10 years. Or if you're a golfer, it can be 2 years. There's no time frame on it. There's a lot of variables to it, but it can lay dormant. So you have this injury cycle going on without even knowing it until the straw that breaks the camel's back, which is inflammation and pain. And now you have the injury. And so that's where you finally say, oh my God, I got something wrong with my shoulder. You've been doing, overhead snatches, and all of a sudden now the shoulder's hurting, but you didn't have one event that caused it. This has been lying dormant for quite a while. And then now it's finally, the body's kind of had enough. And that's really the essence of how these overuse injuries occur. And this really explains it there for you. So this is why it happens. And then, how do you prevent this from happening? If you're trying to prevent it, you're really going to start with the overwork results in and the weak and tight muscles. You want to really figure out, okay, what corrective exercises do I need to work on some of my mobility restrictions or some of my stability and activation issues. So you really want to make sure you're doing corrective exercises for that. No matter what sport you're doing, you want to make sure you're doing correctives. And then as far as the overwork, obviously you want to make sure your technique is good. You want to make sure that your equipment is good. You want to make sure your rest in between is ideal. You don't, if you're a runner or triathlete, you don't want to ramp up your training or mileage too aggressively. There's just a lot of different variables in there. So make sure you're taking those two into consideration when you're doing that. And then obviously you can target some of the scar tissue from a preventative measure with myofascial release, massage, foam rolling, things of that nature to try to prevent this from happening. That's why a lot of people do get body work as prevention, especially a lot of our high-level athletes are consistently getting body work done so they can prevent that scar tissue from happening, make sure there's proper blood flow in the area. You combine that with the corrective exercises, and you make sure you don't have that friction, pressure, or tension in the certain body parts. And so that's how you would prevent it. Typically, when we see someone in our office with the overuse injuries, we have to really target that adhesion, scar tissue area, get that blood flow in there, really aggressively make the changes to that body. Obviously, we're at the point where we're going to be doing rehab exercises instead of corrective exercises to try to strengthen the area or mobility. There's a lot of different things that we try to do. First is to try to decrease that pain, improve the tissue quality of the area, and then give you preventative measures to help prevent, movement-based things to help prevent this from happening in the future. So this is the cumulative injury cycle. This is why overuse injuries happen, whether you are very active or sedentary. This is what's happening, and this really helps guide us from our treatment, but also how to implement preventative strategies. So make sure you're doing that, and you will help prevent some of the injuries. It's never, 100%. You could have the perfect body, perfect training, perfect exercises, perfect everything, and you could still succumb to a cumulative injury cycle with high level or, difficult exercise, sport, and things of that nature. So take that into consideration and try to prevent these injuries before they occur.